Welcome to topic 2 of block 1, where we'll talk about the different scales of evaluation, the differences between research, service evaluation and audit, and also how contextual factors influence the outcomes of an evaluation. As well as several different focuses of evaluation, there are also a continuum of approaches to evaluation, which involve different scales of involvement. As illustrated here on the larger scale, evaluations may address complex interventions which involve multiple connecting parts. These might aim for a change in behaviour of health professionals, involve community-based interventions such as new programmes to reduce the incidence and prevalence of heart disease, for example, or group-based interventions focusing on schools or hospitals or general practices. A large-scale evaluation would be needed where these interventions are intended to be rolled out across broad geographic areas, and are likely to require the input of academic specialists with skills in, for example, health economics and statistics. On the other hand, illustrated here on the left, we have evaluations of local programmes and interventions. This scale of evaluation is the focus of the course. We want to equip you with the skills, knowledge and confidence to design, undertake an evaluation of a local programme. The purpose of this would be to demonstrate success locally, for example to commissioners deciding whether or not to continue funding a new service. Examples of this might include a new service commissioned by a clinical commissioning group, a new intervention rolled out in an outpatient clinic, or a new public health intervention established by a local authority. We'll go through some more worked examples in the next topic of block 1. There's often confusion about what the differences are between research, service evaluation and audit. And one of the reasons for concern about this is that if your evaluation constitutes research, it will need ethical approval by an NHS or social care research committee, and will need to be submitted for NHS and research and design permissions. Even if your evaluation is not defined as research, there may however still be other standards or approvals required. For example, where it's not possible to gain consent for gaining personal identifiable information, or where there may be standards to adhere to in the case of clinical audit. Links to more information about this is included in the Introduction Resources page at the end of block 1. The key distinguishing features of research are that it describes a systematic investigation which attempts to derive generalisable new knowledge. In other words, research is aiming to discover knowledge useful beyond the setting in which it was done. Research can also be evaluation, for example where it attempts to discern whether or not an intervention works or will work in other settings. A link to this is another key distinguishing feature, which is randomisation. While research does not always involve randomising individuals, groups or organisations to a particular intervention, if your work does involve random allocation, then it's definitely research. An audit is an investigation into whether or not a service or activity is in line with explicit criteria, to see if and where improvements can be made. The key feature here is that the intervention, programme or activity is being assessed against agreed, predetermined standards. Examples of this might be NICE guidelines, quality and outcomes framework criteria. For example, the knowledge produced by an audit usually applies only to the context in which it was conducted. In other words, unlike research, there's no attempt to generalise. Service evaluation is designed and conducted solely to define or judge current care, and should answer the question, what standard does this service achieve? It aims to develop understanding and support judgment and decision making. Unlike audit, service evaluation measures current service without reference to an agreed standard or explicit criteria, and involves an intervention in use only. As with audit, there is no allocation to receive a particular service, treatment or other intervention. While the ultimate purpose of carrying out an evaluation is to inform decision making, it's important to consider from the outset that there are layers of influence around the intervention. You ought to bear in mind that your evaluation alone may not be enough to influence decision making. In fact, potentially it might never be enough. This is because decision makers operate in a wider institutional and societal environment. They may themselves be wedded to different interventions. Something's politically favourable, for example. Also, decision makers, whether that's patients, carers, health professionals or managers, may be playing multiple roles, and there could be multiple stakeholders involved in making those decisions. And lastly, there's also practical and resource constraints which influence decision making. the availability of technological equipment, space, staff, expertise, and so on, will all impact whether or not your findings are able to be implemented. However, if you recognise and consider that these other influences are occurring, and appreciate that the evaluation is only one input in decision making, then you can act to maximise its value. This is covered in more detail in blocks 2 and 7, Designing and Dissemination. And lastly, it's important before and during evaluation planning to consider what is the impact of your findings. Evaluations can influence judgment with far-reaching consequences, for example, to services available to patients or the public, and to staff delivering the interventional service. Consider what might happen if your findings are contrary to what was expected or hoped for, and how different groups might be affected should the intervention be shown to be effective, ineffective, inconclusive, or even to have an adverse impact. In the next PowerPoint, I'll briefly introduce 3 case studies, examples of evaluations which we will be using to illustrate and practice different aspects of planning. A written summary of these case studies is also included for you to refer back to.